The IZOview Breast CT System is a system that's really designed around two key attributes. One is providing the best possible image, and the second is women's comfort. When those two things come together, you really have an outstanding system. So let's walk through those. The first thing is the key attributes of providing the best imagery possible for a breast is really no compression at all. Let's not compress the breast so all the structures remain well defined, and the breast can hang freely without being squished between items. Secondly, the advantage of without breast compression is we can use contrast. When you inject contrast, if you can imagine if you can inject dye into an orange and you squish it, that dye goes everywhere and you can't see it. But if you inject dye in a breast or contrast into a breast without compression, that dye gets taken up by tumors and you can see it very clearly. So that's an added benefit without breast compression. So without breast compression, the other piece is that women have a much better user experience. They walk up to the table themselves, they put their own breast into the hole when they lie down. The technician is off to the side, just has to position things underneath. And this in itself is empowering for women. And it also shortens the workflow time considerably. Once the breast is hanging free in the hole in the table, then we're able to take up to 500 images within about 10 seconds. Now, we can reconstruct those images in a variety of ways. We can create a 3D reconstruction, and when you do that, it has the ability to see around images, around structures. You can see what's behind something. You can follow something to see how big it is, whether this is something like a blood vessel that goes off in a different direction. This is really truly powerful. And with all this imagery, people may ask, well, what about the radiation dose? Well, we expect the radiation to be less than 2 views of standard mammography or tomosynthesis. And that 2 views is the standard imaging of a diagnostic view of the breast. So we have less radiation. We have true 3D imaging. And associated with that, then, we really have a shortened patient time in the clinic. A patient would walk up, sit down, they're 10 seconds to take the image, and they can get up and leave. With that shortened patient time, clinics can see a lot more patients in a day. Wait times can be reduced. This truly has many benefits.